Hi, this is Dr. Dumestri, board certified plastic surgeon, and I'm going to go over ALCL today. So that is a rare form of lymphoma that has been found associated with textured implants, implants with a roughened surface. So I'm going to go into some of our most recent evidence. So ALCL refers to anaplastic large cell lymphoma. When it was initially reported back around 2011 is when the FDA formally put out a statement addressing this concern. We thought that the occurrence rates were closer to kind of 1 in 30,000, then that decreased to about 1 in 3,000, and currently with registries really keeping track of how many of these cases are actually happening, the number is around 0.5 to 1%. So I'm going to look at this study performed by Drs. McCarthy and team, looking at the information that has been gathered from 2012 to 2023, information on symptoms that patients present with. This is a national registry, so it captures all of the cases in the U.S., the treatment modalities that these patients underwent, and then how they did long-term, survival rate, etc. So first of all, what is a textured implant? This is an implant that actually has a roughened surface on it. The reason that they created this type of texturing was to allow a shaped implant. So a teardrop implant, you can see from this side, it's smaller up top and then gives that natural breast shape. That is in contrast to a smooth, round silicone implant. So the smooth, round silicone implants, they'll naturally assume a bit of a teardrop as they sit in you, but they can rotate around any position, doesn't matter. The teardrops, on the other hand, because they're shaped implants, they can't sit however. They need to stay in the position that you implant them so that you don't have more fullness at the top of the breast if it were to flip. So the texturing process is done so that your own tissues can stick down and adhere to this, keeping it in the right position. So when we look at the symptoms that this study found, they found that an overwhelming amount of patients, their presenting symptom was seroma. Average time of implant placement to diagnosis of ALCL was around the 11-year mark, so it's not something that happens immediately after implant placement. Seroma refers to a fluid collection, so you actually can see on yourself that one side of your breast is getting progressively bigger compared to the other. Then when you go to your doctor, they can test that fluid, send it off to double check, make sure it's not ALCL. Spontaneous seromas can happen for other reasons also. The other two most common presenting symptoms were a palpable mass or a little felt knot on the breast, or capsular contracture, a tightening of that capsule around the implant. Only 9% presented with systemic symptoms, which are more classic for presenting cancer: fever, night sweats, unplanned weight loss. When we look at the type of implants that these patients had, 87% were textured, so of this roughened material. 9% we had no implant info, and then of the 4% who had smooth implants, all of them had a history of previous textured implants or expanders for reconstruction. Now, the type of treatment that's recommended once you've had a diagnosis of ALCL is implant removal with complete en-bloc capsulectomy, meaning you're taking everything out as one with a little rim of healthy tissue. This is when that term is used appropriately for ALCL patients. ALCL and breast implant illness have nothing to do with each other. Breast implant illness, there's no indication for complete capsulectomy, and certainly not en-bloc capsulectomy, which carries its own risks. As far as the treatment response, when we looked into the future, how these patients did, the large majority, 85% plus, did great. Some of them had just implant removal. Some had been exchanged for the smooth, round silicone implant with no further symptoms, no further issues. There was a 5% mortality rate, 6 of the 114 patients affected. Of those, 3 of them had died due to other causes unrelated to the ALCL, and then 3 of them were due to the ALCL, and 1 of them had refused all forms of treatment. So overall, this is a disease with a very good prognosis when the recommended treatment is undertaken. Now, the question remains what to do if you have textured implants but you have no symptoms. So currently the FDA does not recommend removal for everyone, but recommends instead a consult with a surgeon to understand the presenting symptoms, to understand the risks, and to help you make an informed decision. If you do want to have the implants out, there's basically three options. When I am removing a textured implant, I do perform a capsulectomy, given there are those cases of smooth implant patients affected with the history of the texture. So option number one is removal of the implant with capsulectomy. That's it. Option number two, removal of the implant with capsulectomy and replacement with a smooth round silicone implant. And option number three in the cancer patients is removal, capsulectomy, and then replacement with autologous reconstruction or using your tummy tissue for a DIEP flap. When we look at this study, seeing what do people typically pick, still about 70% of women opt to just undergo routine surveillance of their implants rather than have them exchanged immediately. Of the 20% that did pursue implant exchange or implant removal, a lot of them had a history of breast cancer, which makes sense. You've already been affected by one type of cancer. That risk tolerance to this ALCL, although low risk, is minimized even further. In my practice, I now use all smooth round silicone implants. There are still textured implants available on the market. The texturing process, how they actually coat it, differs between companies, and those carry different risks. That being said, aesthetically, even when they did the studies, when we had lots of both to compare to, aesthetically it's very difficult to tell the difference between a round implant and a shaped one, because once it sits with you under gravity with the breast gland, the mastectomy skin potentially covering it, those differences aren't super evident. Hope that helps. This is a long and complicated topic, much like breast implant illness. Have a great day.